Hey Joe, welcome.
Hi, sorry I couldn't be there in person. I'm the only one holding down the accounting world in Sun River today.
Calling the meeting to order. I think we do have a quorum. Hello, Ed. So first we'll start with introductions, and we have some new folks here. So first of all, let's get the folks that are on Zoom. So get them. I see Joe. Joe's here.
Hi, everyone.
Okay, Joe's a member of the audit committee, right? Gabrielle?
Hi, thank you. This is my first time at one of your audit committee meetings. I was an auditor up at Metro, and I am looking into your audit office. Thank you.
Welcome. No one else, right? Okay, let's start.
I'm Eric Croft, Deputy County Administrator, and also the county's risk manager.
I'm Whitney Hale, also Deputy County Administrator, and I'm the county's communications director.
Sarah Crosswhite, Deschutes County 911 Director.
Bill Anderson, public member.
Liz Foot, public member and brand new.
Welcome.
Committee.
Yeah.
Marjorie Lunan, I'm on call with the RV park. Deschutes County. My husband's also the fair manager, maintenance manager at the RV at the fairgrounds.
Great. Well, welcome aboard. Welcome. Darrell Parrish, public member.
I'm Elizabeth Pate, the county internal auditor.
Steve Dennison, County Clerk, new department head member.
And welcome. Thank you.
I'm Nick Levi, County Administrator and ex officio member.
And
Trixie Volkin, I'm HR analyst specifically responsible for benefits.
Ah, okay, welcome aboard, welcome here. Okay, we have minutes from the June 13th, 2005 meeting. Also, we had a tour of the courthouse facility on July 25th, and we have some minutes for that, but I don't know if we need to do anything with those. It was a limited.
There wasn't a quorum at the meeting,
Okay.
but Daryl was the only, Daryl and Lee were the committee members.
Yeah. Okay, so they're there. We don't necessarily need to do anything with those. I will submit the minutes from the June 13th, 2025 meeting.
Just one
Approved.
thing,
Okay.
Jody Birch is just joining us.
Oh,
Jody,
great, okay. Oh, hi, Jody.
We're in between introductions and approving minutes. Do you want to introduce yourself?
Hi, Jody Birch, public member.
One of the veterans.
Yeah.
Okay, so submit the minutes of the June 13th meeting for approval. We have a motion to approve. Any additions, deletions, questions, changes?
I'll move to approve the June minutes.
I'll second. All those in favor, say aye.
Hi.
Aye. Any
Aye.
opposed? Hearing none, minutes are approved. All right, internal audit reports. The first one is the recreational vehicle park report and presentation.
I'm playing double duty here because but I want to make sure Kim Riley gets admitted. Oh, there it is. Okay. So the first one we're gonna do is share a report on our recreational vehicle integrated audit. So the original audit was published last summer, August, just after the fair. And so we followed up on our recommendations from that audit. The background on the RV park. So it opened in 2007. It has 105 full service sites with access to the fairgrounds, which hosts over 400 events annually. This is the attendance for the RV park. So you can see it's very seasonal with most of the visits during the last week of July, which is traditionally when the county fair is held. So we'll do some updates on the recommendations that we made. So overall, we see 4 recommendations that are in process. One where management has accepted the risk of not implementing the recommendation that was related to performance reporting. So our first recommendation was to perform a fraud assessment. We found that staff hadn't conducted a fraud assessment at the RV park. They're a good way for management staff to collaboratively think about risks and to design preventive measures to prevent fraud. We recommended that Fair and Expo Center conduct a fraud risk assessment for the recreational vehicle park and document those outcomes. Management reported that they're going to be working with finance to strengthen controls and transparency. They're going to have finance on site to assist them with observations and evaluation. The next recommendation that we found that there weren't any comprehensive accounting procedures dedicated to revenue collection for the RV park. Especially noteworthy because they had adopted some new software during this time and hadn't updated their procedures to reflect new business processes associated with the new software. So we recommended that they incorporate those fraud risks into updated cash handling procedures. And again, they said they will be working with finance to implement that work and update those cash handling procedures. I did want to note, I mean, these are good. We like them taking those steps and we like them consulting with finance. But this is more than 9 months out from us making those recommendations. And they still, at that time, hadn't worked with finance yet to implement those things.
Perhaps they'll start there. I know the slower part of the season is coming up. Perhaps they'll start that.
Perhaps now, yeah.
When it slows down.
Yeah. So we also found that, as mentioning again, the new information system, they didn't have procedures also that were applicable to that information system. And that's for this one. So we also recommended that they incorporate any results of their fraud risk assessment into new information system procedures. Again, they were working with finance on that. Oh, and so one of the things I did want to point out, this recommendation was, one of the things we found was that when they had initially implemented this new system, management had a lot of broad authority to perform both review and oversight procedures as well as implementation procedures. Usually you want to segregate those so that you have eyes on processes. And so they had never gone back and sort of assigned users user roles that would account for segregation. Wasn't that staff had a lot of roles, but management had too many roles. We saw that the RV park and as well as the Fair and Expo site and Fair and Expo Center in general have their own website, and that it didn't meet Americans with Disability Act requirements for accessibility for people with sight or hearing impairments. So we recommended that they follow through with their plans to rebuild the webpage in compliance with the Americans with Disabilities Act. They said they had conducted an initial review and were working with a consultant on and have implemented some changes to that, but still had more to work on. And then this is the one where they accepted the risk. We found that they did have some reporting that was focused on revenue, expenses, and local impact that was associated with updates they gave on their budget. But they didn't really talk about more operational indicators such as occupancy rate or such as occupancy rate or customer satisfaction. We recommended that they establish performance measures that were specific to the recreational vehicle park. They decided to not establish any new performance measures and instead report on things like occupancy within sort of the context of the broader Fair and Expo Center. We feel like this line of business is unique enough that it's, it would be a good idea to report on things like occupancy. So our next steps are to continue following up on in-process recommendations through our global follow-ups. Any questions?
Questions for anyone?
How do global follow-ups, or what's that procedure look like?
So I will reach out to departments usually starting in about October, give them a list of all of their outstanding recommendations. So anything that's listed in process. I don't think we have any that are more than 4 years old, but going back to older audits, they'll give updates and then we'll report out on those and usually have a report out in January. That's a combination of status updates on recommendation and then also our offices. We'll share that with you probably in February.
When you have a finding such as that management was assuming too much of the workload or tasks or however you put that, and the staff was not handling enough, how would what's the expectation for the department to handle that, to address that? Is that, I mean, it sounds like that could have a budgetary impact or something else. How would they go about?
So it's not about workload, it's about really the work, the kind of work that you do. So the segregation of duties is really that one person has too much control of the process. So I think one of the things that happens in the that was happening in this audit was that management had the ability to delete some records that so it's really more about how the process works, how tasks move between staff rather than workload.
Yeah, I'm just envisioning that if it was something, if it was a task that management felt that they should be responsible for, then maybe not staff, then who else? So if you're adding another layer of management or other staff to create that that layer that you're asking about, so the budget impact there.
I think, you know, there's options for management to accept risk, because sometimes budgets mean we have to accept more risk. There's also ways for people to do concurrent review. So if management really had to perform the task, you might even have someone who's lower level to also be involved to sign off as well. I mean, it's really just looking at where your vulnerabilities are for fraud and making sure that that no one even has a chance based on the tasks.
Do you have opportunities to provide advice maybe on how that can be accomplished in an efficient way that may not have budget implications or?
Yeah, and actually in talking with staff about this one, I think it really was just oversight. It was that, you know, it was an oversight that when they had implemented the software, they just never went back and changed the roles to reflect how they wanted it to operate in practice.
Anything else?
Just a real quick question, a couple questions real quick. So the cash handling procedures, I'm taking it that when people check into the RV park, they're paying in cash?
They aren't typically, no. So
Okay.
when we talk about cash, we're really talking about any forms of currency.
Of currency, not just cash,
It
okay,
also would include credit card payments. So
Okay.
in fact, most transactions are taking place through credit cards ahead of time through a
Online?
reservation system.
okay, that was gonna be my next question.
Occasionally, someone will come in and off the street and wanna stay the night and have cash.
Okay.
Anyone else? Anyone zooming in? Okay.
Not on this topic. Dave Doyle is on, just trying to get in on Zoom, and then he'll come down for a couple portions in a moment, and I just didn't want to mess up your Zoom.
Has he not been able to get?
Maybe he's-
Maybe it's over here.
Maybe you just need to be let in, or I'm not certain.
I'm not saying that he's trying to get it in.
Okay.
So I don't know if he's-
So county legal problem.
Kim Riley
Okay.
was there, but it's like she's gone now.
Elizabeth, can I just add something to that?
Yes,
So the system that you're talking about, the system that we use is like 3 years old. So it's not new of 2024, correct?
yes.
Okay. Just wanted to bring that up. It's
So
not a new system.
it's not that we were dating them on this, 3 months after they had implemented it. It had been something they were neglected to do for a period of time.
Okay.
Anything else on the RV park? Commissioner DeBonne has joined us. You're welcome. Hello, finally. Okay. Move on to the next item, which is the health benefits report presentation.
So this is also an audit update on the health benefit audit that we originally published last September, on the 23rd of last year. So just some background on our health benefits plan. So We are a self-insured health benefits plan, which means that rather than paying a premium rate for each participant to an insurance company, Deschutes County sets funds aside and pays for each medical procedure for people who are involved in the plan individually. And so that's part of what Trigby works on, and then we also have an administrator who is Pacific Source who has more expertise in doing that. So they are the ones who pay those premiums on our behalf, and then they bill us. So who are those participants? They include county employees, dependents, and some retirees. We also, as part of the plan, includes the Central Oregon Intergovernmental Council, and that Black Butte Ranch Service District also participates. In fiscal year 2024, we spent $19 million on 3,476 participants. There's a few different roles within the health benefits program. Some are really looking at finance, some more at implementation of this benefits, and some do both. So people who are involved in finance and oversight include the Employee Benefits Committee, Finance Administration, and the county administrators who choose what rates to set to charge both employees and departments. Implementation is done mostly by Pacific Source. That's the company that actually pays out the providers and receives the invoices from providers for services. And then Davidson was our consultant, our health administrative consultant. We now have a new one. I don't remember the name. USI. But Davidson was the one at the time of the audit, and then Human Resources does a whole bunch on both sides. Just to kind of give you a sense of what we're talking about here, these are the most common procedures in 2022 and 2023. The most procedures were psychotherapy visits, which I think is there because you'll do those on a regular basis multiple times a year, both low-level and mid-level office visits, and then our massage benefit. But those are not the most expensive procedures. You can see these are, very less than 200, not very much money. These are the most expensive procedures that we saw during those years. One over $100,000 for rehabilitation for someone who had a significant injury.
Was that a work-related injury?
No, it was not a work-related.
Okay, so it's personal.
Yeah. Yeah, this does not include our workers' comp.
Okay.
So just to see one of the things that brought up the risk and why we took a look at this program is that during this time or right before this time, we were seeing a pretty significant increase in costs. Between fiscal year 13 and 2021, we saw about 3% annual change in costs, and that went up to 13% annual change after fiscal year 2021. Some thoughts that some of those charges were a result of pent-up demand related to COVID-19 closures, but also just really increasing costs, not just more services, but actually more higher charges for services. So one thing that happened as we saw this is that our fund balance was decreasing a lot at the time. So it decreased from $18.1 million. This is the amount we sort of had on hand to pay out claims in March of 2019 to $3.4 million in June of 2024. That there's two other lines there, which is the contingency and the claims reserve. State law requires the county to have a claims reserve at a certain level determined by actuarial calculations of based on past claims that it needs to have on hand in case it stops running the program. So this is the amount that would be available to pay any claims that come in after the program ends. And then by policy, the county had an additional contingency amount that was sort of a buffer over that. And then, so you can see that over this period, the fund balance went below the contingency and started nearing the claims reserve required by state law. So that was all during the audit. So here are the updates. We found an improved financial model and system and better financial health, but some information security risks persisting. 1 recommendation resolved, 3 in process, and 2 where management accepted the risk. So the first recommendation was related to those reserve levels. And we recommended that the county conduct an after action review to look for the root cause about why the health benefits fund fell below contingency and steps they could take to prevent that in the future. Finance and administration conducted, and HR conducted a root cause analysis, which they reported on in their response to the report. And they revised and recalibrated the forecasting model, and I think they're in a much more healthy financial position. You're above the contingency level now, is that right?
Estimated to be at 10.2 million at the end of June of 2025, so.
Much better.
No, 2025, end of fiscal year.
Let's see. So we had findings related to information security, and we had 2 recommendations related to this finding. So one thing that happened is during the audit, the contractor Pacific Source shared with us some pretty sensitive medical data about other clients. When we asked them why, what happened, what were your controls, what went wrong, and what are you going to do next time to make sure you don't share sensitive information, they didn't share that with us. A lot of agencies who hire third-party administrators also request those organizations report what's called a service organization control report. That is an outline of internal controls related to information security, but also other areas of their operations that they certify that they will adhere to. And it also includes some controls that they want. The clients also are responsible for implementing. Then periodically, they're required to have external auditors come in and certify that they're following those things. And then they can report that to their clients to demonstrate that they have good information security controls in place. And so we recommended the county request that or add a requirement for that in the next health benefits contract. The county decided not to request or to include that in the request for the next contract, and instead to rely on what the organization did have, which is called a high trust certificate. This is something that's specific to the healthcare industry and includes not only information security, but also HIPAA compliance and other financial compliance. The difference between that and a service organization controls report is we really only see the compliance, the certificate. There's a report that they have from the group that does the compliance review that says like, oh, well, here's some areas you can improve upon, or in order to certify you, we want to make sure you're working on these things. But they wouldn't share that report with us. So the difference is really what they have, you just get a stamp of approval. What we would be requesting would really be an outline of their internal controls and external certification that they were following them. And the other reason difference between those is they did have the certificate and they still shared sensitive data with us. So it sort of leads to the question of, well, how meaningful is the certificate if you're still having sharing information you should be sharing. Related to this, we had a second recommendation was that they should create a policy for reviewing those service organization controls reports. So not only should they request them, but then they should also review them and communicate with the organization if they were falling short on any of those controls. But they don't need to, they will not be doing that because they're not requesting the report. The next recommendation was related to performance measurement. We rely on the third-party administrator to make sure that we're spending the right amount on claims and turning them around in a good amount of time. It's pretty typical within the industry for administrators to report to their clients on payment accuracy, financial accuracy, and timeliness. And there's also benchmarks that are industry standards for performing on those areas. Pacific Source was not reporting on those to Deschutes County. Deschutes County agreed to start working with the contractor to track that data and said that in future contracts, they will make a requirement for reporting on those areas.
So the TPA would report on those?
And then this was also a related recommendation that they would share that report with the Employee Benefits Advisory Committee. So Human Resources, they did share some data with the committee on July 25th meeting, which took place after this report went out. But then that data wasn't specific to Deschutes County. So I think Trigby's going to be working with them to get some more specific data. And then I think this is the final recommendation, was related to internal processes, Deschutes County processes to pay the third-party administrator. So we did a review of payments to the third-party administrator and found that they were accurate, but we did note that this is a high-risk area because the third-party administrator is paying for claims before Deschutes County pays the third-party administrator. So they're sort of out some money before we reimburse them, and we actually process these payments off cycle more frequently than we do other payments to vendors. And they're also pretty large. This is one of our, after payroll, one of our largest line items. So wanted to make sure that there were written procedures in place for how invoices would be reviewed and paid to Pacific Source, especially because you might, if someone's out, you might need someone to fill in to make those payments. So Human Resources is working, they have a new director, and so they're going to be working with their new director to approve those new procedures. That's it. So we'll continue to follow up on those recommendations at the global follow-up. Any questions and comments related to health benefits?
Are there any legal ramifications for Pacific Source sharing more sensitive information than they should have to anybody?
It didn't meet the criteria for a data leak. And so state law does have some requirements for certain kind of data breaches. It wasn't to the extent that it fell under those procedures. I think in part because it was not an ill-intended event that they shared it with us by accident. Instead of a party sharing it with ill intent. And also not, I think that was the criteria they didn't.
Okay.
Yeah.
So I was just gonna ask, you kind of hit on it, but would you describe it as kind of an isolated incident or something more significant?
I think it was probably isolated and had to do with, they were typically sharing this information in this way, because we were asking it as auditors and not through the typical claims review process.
Yeah.
But I think it still highlights, there are things like that happen, and it's good to know what your internal controls are in order to prevent things like that.
Thank you. We, admin, HR, have some responses to the report and the recommendations. Whitney, I'll certainly invite you up, and Trigby, I don't know if you're going to participate in this discussion or not. Two comments. One is first, the fund the slide that you have with the graph that shows the fund below contingency and year reserve. And it's showed back in March of 2019, an $18.1 million fund balance, and then you see how it goes, it declines. I just want to point out that we've been watching this fund and making a lot of decisions, careful decisions about this fund over a number of years. And as we get to the right of the chart, you'll see it drops below the contingency line, comes back up, drops below, and comes back up, and drops below again. And then, of course, as Whitney mentioned today, it would show that it's at 10.2 million. We were continuing to make decisions all throughout there. For example, we would increase costs to departments as soon as we saw it go below, and we thought that was going to be enough. It clearly wasn't. It dipped. That did generate revenues. It declined. We increased those again. We thought that was going to be enough, and it was close, and there was a nominal increase to employees as well. The key is we didn't want to overreact with any one of those decisions because those are significant impacts, cost impacts to departments, which then directly impact services we provide. So we tried to make very strategic decisions on those. So that's why you'll see it declining and kind of the zigzag there at the right. And then we feel like we're in very good shape right now. That's my first comment. Happy to answer any questions about that. On the recommendations, we do disagree with the two accept risk recommendations. The categories that we have resolved and in processes, and those both relate directly to the internal auditor's recommendations. If we are implementing the internal auditor's recommendations, there's not a category for managed risk differently, and that's exactly the box we would have checked if it had been available to us. Now, we still would not agree with that, and that's fine. But we believe that we are managing the risk differently than what the internal auditor has recommended, what Elizabeth has recommended. And that's where I want to turn it over to Whitney to be able to explain how we believe we are managing the risk differently, because it is a risk and it is important, and we want to make sure that we address it. So I'll turn it over to Whitney.
Thanks, Nick. We did feel like it was helpful to provide the committee with just some additional information on the follow-up that occurred kind of during and after this audit. So I think we had a lot of discussions around the SOC report, which is what Elizabeth recommended that we require for this contract. And actually, we're having additional discussions during the audit period about should this be a requirement for all contracts or certain subsets of contracts. And really what came up over the course of that discussion was we don't believe on the IT side that we're staffed in a way that we can receive these reports for all of our outside vendors, analyze them, communicate back to the department that manages the contract. We may be someday, but currently with the way we're staffed, especially in our cybersecurity lane, we have one person that's really the resource dedicated to that. So we didn't feel like the SOC was something that we were able to lift at this time. We also were concerned that implementing the SOC for this contract in particular potentially could add cost to the plan in a time where we're really trying to be cognizant of what that looks like, both for staff and for departments. They've seen some, as Elizabeth highlighted, increases over the past couple of years. So we're really being cautious with additions to the plan. But that being said, we really take the risk seriously. And so after this audit, we formed a work group, IT, finance, admin, HR got together and said, what are ways that we could have more eyes on not just this third-party vendor, but other third-party vendors. There are vendors that the county does business with that have access to a lot of information. And we want to make sure that we have a process that we're comfortable with there. And so we ended up going out and we have a new contract with a company called Black Kite. Black Kite evaluates risk for third-party vendors, Pacific Source being one of them. And we're working through what's more of a real-time evaluation of kind of how are these companies scoring in a variety of areas. And the folks that are managing this are able to log in and see a dashboard of scores real time. And as risks come up, we get alerted to that and we're able to communicate both with Black Kite and with that vendor directly. So we feel really good about this as a tool. It's something we're using on the procurement side to kind of assess what's the risk from a cybersecurity lane as we consider doing business with folks and also for longstanding contracts that we have in place like this one. So just wanted to share that work because it's new space for us, but really something that we're excited about moving forward with. We did have you know, the black kite, I wanted to just kind of report back on, you know, based on the latest data that we have. It looks like Pacific Source's rating is in a higher tier of kind of what we would expect to see there in terms of the score that they're getting for cyber ratings. And so that's helpful to us. But again, we're using this tool to evaluate multiple vendors across all areas of the organization. We have a subcommittee that Eric and I sit on that we're really looking at what contracts make sense to use this tool for. And so I think it's space we're gonna need to expand on as we move into the future. So just wanted to provide that additional context to kind of the follow-up that occurred after this audit and where it may go in the future.
Can I get a high score that you have more confidence in them?
Yeah, and I don't wanna get into kind of, I'm trying to sort of protect, and I can follow up offline, but in a live stream meeting, sort of taking a vendor and talking about another vendor score, but yeah, their scores are positive based on the tool's assessment of what we see. And again, our cybersecurity manager is saying this is a real-time analysis where I think we would see the SOC as more of a point-in-time analysis. So hopefully that's something that will be helpful to us as we move forward.
That wasn't information we had at the time of the follow-up, so maybe we can meet and talk about that as we go towards the global and talk more about what that entails.
Okay, that sounds great.
Was the information shared with, I'm guessing it was in written form through documentation, or was it verbally shared in meeting?
It was all of the claims for thousands and thousands of people, all of their medical procedures.
So with that, I had a follow-up question to that too, as a county employee or on behalf of county employees. Was that granular level of detail of, I sprained my ankle, or I got a 15 massages last year in the last 2 years? Was that level of detail shared with your department? As an employee, that would concern me, but.
It was another organization, I mean, it's still concerning, but it wasn't our employees' protected information, it was another.
Yes.
I think Steve is saying he's concerned that I saw that.
Yeah.
Yes.
Yeah.
Yes.
Yeah, but I just wanted to clarify that it
Okay.
wasn't our.
Our reach was outside.
Yeah,
It was, they were sharing a different
Correct. I just wanted to-
groups with us.
Yeah, it wasn't our employees' data.
That's
I
an
mean, it's
important
still concerning.
That's still,
Not necessarily better.
no.
Exactly.
It depends who you are.
I would use the word, but I didn't, I mean,
Because it could be happening in a different, situation where
If
it's
there makes
our
sense.
information that's going to somebody else, and we may never know.
So not requesting an audit, can I ask why we decided to do that, or how are we holding Pacific Source accountable? What are our steps, or the county steps to hold them accountable?
We're using this third-party tool to basically, they're one of the contractors that we've said, we believe that the type of data they have access to and sort of the scope of our relationship makes sense to have Black Kite monitor Pacific
Okay.
Source and report
I got
to
it,
us
I
real
got it.
time.
Okay, okay, I misunderstood stuff, okay. That makes sense. I mean, I know an audit can be timely and costly as well, so.
I think we're trying to balance all the factors, and at least for the time being, we're pretty excited about this new relationship we have and the capabilities it gives us.
That's good, that's enlightening.
Comment from the peanut gallery, if that's all right. So, yeah, I mean, I'm a commissioner. So the claims reserve, 2010, it was headline news in the daily newspaper saying, Deschutes County Reserve way above, requirements. Why is that? So it's like we were pushed hard by the media at one point because the reserve was high. But when you look at that, it was basically a very healthy reserve for a long period of time. And what this tells me is that the environment changed so quickly, and management did change internal charges to respond to it. But this is a self-funded healthcare program for 1,500 employees plus dependencies, so 34 something. She said that is very interesting information because everybody in the market is dealing with this, but this is very public information, for a set of people that work for a government. So as I say, it's great that we're keeping track of these things, and it's scary we touch on the claim reserve minimum. But that shows huge moves in the market very tangibly. So I just acknowledging that's what we saw there, because there was a couple of years where we did not raise internal fees and it still stayed high. It was just amazing that the last 15-year history on that. So that's what I took away from that is the market's changing very fast. And that's inflation and cost of business and everything.
Do we have the oscillation at the end, all the way to the right that you were talking about, responding, something happened, responding, which is, I understand that. Do we have an idea of why we saw that oscillation? Does it have to do with population? Does that have to do with cost? What?
Yeah, we know-
I'm
we know-
just, I'm interested.
we know
I'm not pointing
exactly.
fingers, but I was just,
No,
I'm
no, it's
interested.
a very good question. We know exactly why that is.
Okay.
Both Whitney and Trigby can answer that question.
Yeah.
And just to clarify, are you speaking to the trend down and then the bounce back up?
Yes. Yeah.
So Trigby, I will let you talk about the trend down if you want to, and then I can round out and talk about the trend back up if that sounds good.
Sure. So there were several factors that came into play, particularly post-COVID. There were a lot of procedures that were not being performed during COVID. You know, anybody that needed their knee replaced or their shoulder fixed, people were delaying that. That also caused folks that might have had an underlying condition for that to go from like a stage 1 to 2 to a 3 to a 4 before it was finally caught. So when they got back into the normal process of, you know, doing surgeries and testing and things like that, colonoscopies, all of that stuff, we found a lot of cases that have progressed severely.
Okay.
Plus, there was a lot of just pent up things that people had not had done. So we saw a big push there. That also coincided with the inflation of just medical costs. Central Oregon, as we all know, is basically a one hospital system, you know, it's St. Charles, and they're driving the cost and just the cost. There was also a big turnover in staff at hospitals and facilities. They were really struggling to staff, so they were bringing in traveling nurses and doctors, and that cost was incredible. So we literally, and we had been working with Davidson, who was our benefits consultant at the time, you know, we knew this was coming and they were trying to anticipate how much this big increase was going to happen. And they were way off. We were all off, all across the industry. People were off, and we literally, boom. And then our plan on top of that, we really try to manage our preventative care, and so we don't have big, huge, large claims. We try to make sure people are doing their preventative, getting tested. You know, we really work to keep people healthy and out of the hospital, but we actually had some huge significant claims. We had some transplants, and then the follow-up, you know, anti-rejection medicines that come along with that, which were kind of out of our norm. For the industry, we are still below, you know, for these large claims, but when you have, you know, a transplant and a severe, you know, cancer claim where, you know, there's $2-3 million right there, and just a few of those that the timing just happened to hit where we were just like, we were coming up on the end of the fiscal year and we're like, okay, we know we need to increase the department charge this month for the next fiscal year, and all of a sudden we get this claims data and we're like, boom, and that's where you see the dollars drop.
And this is against the backdrop of like 10% annual inflation for
Right,
years.
right, exactly.
Right. And we were always trending under the national average. You know, the national average was always kind of around 6-7%. And we were, like Nick said, we were at like 3-4%. So we thought we were doing so good. And then all of a sudden, just it was like a whole storm of these different factors
People
that
coming
hit
in,
us
did procedures, preventive care.
all
that
at
kind of
once, and just we burned through, as you can see.
Yeah.
Burn through that reserve quickly when we were trying to, over time, bring it down to the proper levels. But yeah, we went off a cliff.
Perfect. I figured, thank you.
Yeah.
And then in response to that, we, as Nick mentioned, we increased rates to departments, but we also knew that we had to look at plan design because it felt like the plan design we had previously wasn't sustainable. So we engaged our EVAC committee, which is made up of both staff and management, and we said, We would like you to come up with a recommendation for the board to save $2 million next year and ongoing cost. And here are a variety of ways that you can do that. And we really let them have a discussion about the ways in which they wanted to modify the plan. And they made some hard choices, but they made good choices. And that's really reflective in this bounce back up. We've had some formulary changes. We've also and this was outside of the EBAC process, but or with a new PBM, so the people that are managing our pharmacy benefit, that's different, and we're seeing stronger rebating come out of that contract than I think we have been previously. So it's a variety of factors, but we're really pleased with the plan design changes that were recommended and the board approved. They really look like they're getting us where we need to be.
Do they involve reduction in benefits?
There were a few modifications, but again, staff that represent our unions, that's how EBAC membership is driven, had the opportunity to weigh in on kind of what mattered most. And they had some tough decisions to make, and a lot of opinions in that discussion about this benefit is really important to me, or keeping the employee cost share at the rate it is matters the most to the folks that I represent. So it was a really valuable discussion to observe. And I think we got to a place where we still have a really robust health plan and offerings for staff. And so I think we're happy with where we are today.
That process was so much better than it would have been if just admin and HR had made a decision and said, this is what we're going to do. It was such a robust discussion. Everybody owns the decision and the plan and where we're at and where we're going. So it's, we're just in a much, much better place than we would have been. We hadn't engaged employees in that discussion.
Awesome, that's awesome.
Thank
You guys
you
just
very
bounced
much.
right off that claim reserve.
Yep, it's a lot of great information. Thank you.
And it happened back-to-back years.
Yeah.
And that was really tough, yeah.
I still have another follow-up question, but if I may, about just the data that was shared. The county data that was shared by Pacific Source to the county. And then that other inadvertent data that was shared with the county from Pacific Source. Can't Pacific Source anonymize? Can they make it more private? Can they just give you granular data or whole data, 3,500 or 3,400 employees? Here are the numbers of people that needed this medication, that medication, did that version, that and whatever. If they did that, if they just kept it anonymous, provided that data for the 3,400, you would know that there was no overage, but of the employees to say, hey, you gave us some other data, give us the 3,400, but it's all anonymous. Can't they provide that so that you don't have
Without the name.
that I sprain my ankle?
We wanted to be able to track by person to see that people that the services that were provided to people made sense. So like seeing were people getting double like, oh, someone's got 2 right hip replaces. That doesn't make sense. We're gonna get 1 right hip replace.
Or to assign a unique ID to the person saying, not sharing that I see Dennis got my nice ankle.
Yeah, I think the
year.
question is it possible for Pacific Source to identify a person by a claim number? It's something that we would know, so we can look it up by claim number. I don't know if that's possible or not.
My understanding was that the data they provided was based on the parameters you set in the request. Is that?
Yeah, and yes, for identifying information and we have processes in place to keep it confidential. And so that's,
They just gave too much.
They shouldn't have given other people's data.
Yeah. Got it.
We do have an internal HIPAA policy for the county, so folks that do have access to personal information, myself included. I've been through HIPAA training and I've been certified and signed off that I would not obviously share that with anybody, you know.
And Aaron and I also went through all that.
So I think the biggest point was that not so much the actual data, it was the fact it was the wrong data.
That's the problem, yeah.
Is the problem.
Yeah.
So because if it were our people's data, we have people who are trained in HIPAA who keep it confidential, and we have procedures in place to keep that information confidential, but it was somebody else's, it was the wrong organization's data. So.
Good example that type of thing can happen though to any entity, Pacific Source, but it could be us too.
Yeah, oh, absolutely. So this is a Pacific Source issue.
Yes.
The way I see it is, but they didn't handle it correctly.
Okay.
Anything else on that topic? Anything else? Okay, all right, move on to the next,
So just an update from you all, to you all about what we're working on. We're wrapping up field work on the sheriff's office body and audit camera program. So we're wrapping up getting our final data requests in and drawing our conclusions on that. The 2025 elections audit in the clerk's office, we shared with them our preliminary conclusions. So they're looking at those now, and they'll give us their sort of responses to that and see if we have any more work to do on that. Steve's working on that with me, so we'll look at that probably next week or week after, because I think you're out of town next week.
Yeah, that's right.
Then the house census audit has still been on hold. I don't think I've done any work on it since we last met, but we'll keep that off at the sort of preliminary planning stages. And then there's just a link to the status report for anyone who's interested in more information about like how our time has been split up between actual auditing and other administrative functions.
we have a copy of that, right? That's.
Yeah, and there are copies back there as well.
Questions on that? If none, move on to the next item, special topics. Scope limitations impacting audit oversight and ability to draw a report on conclusions.
So this was something the audit committee requested to add to the agenda. Last time, I mentioned to you a couple of scope limitations that were coming up and wanted to have an opportunity to ask more questions. The first one was when we were talking about the risk assessment and audit plan for the next 2 years. County legal had informed me that the audit code didn't apply to 911. If I made the decision that if the audit code doesn't apply, then we can't really audit them because our auditing procedures are sort of outlined in the code and that authority. So we didn't include 911 in the risk assessment for the next 2-year audit plan. Also, we had talked about scope impairments on the sheriff's auto and body camera audit, that the sheriff's office didn't want to share body camera footage with us to review. That was really pretty integral to drawing conclusions and fulfilling the objectives of that audit. And so I did let the sheriff's office know that you had requested to speak with them. It looks like they haven't sent a representative. Let's talk more about Jeff Price. Oh, well, I'm sorry, Jeff Price is here. Sorry about that. And then the third one was the scope limitation on the elections audit related to information security, and that we weren't able to draw conclusions related to the clear ballot system. So I don't know how you wanna.
Well, why don't we take them one at a time, I guess. So with regards to the 911 service district, we start with that. Okay, that's the first one.
Yeah.
You mentioned, so the question was, does the audit code apply to 911? That's the question. Dave, maybe give us some clarification on that or explain that or.
Sure, the 911 is a county service district, it's not a county department. And so to the extent that they are engaged with the county, they do that on a contractual basis. There's no legal statutory basis for that. And I'm unaware of any contractual basis where they've obligated themselves to be the target of an internal audit. If they choose to do it, I believe they have the right to do that and they could contract with the county for that level of service, but they haven't done it. And I don't believe the county can compel that in as much as they're a separate legal entity. They're not part of Deschutes County. They're a county service district, no different than Sun River, no different than Black Butte Ranch, no different than 4-H. And so by virtue of that, if they're going to be audited by the county internal auditor, then that county service district would have to contractually agree to that. And to my knowledge, that hasn't occurred at this point.
A counterpoint to that is that we do have an MOU between the county and 911 that says that they will provide the district with administrative services in the same manner with, in effect, as services are provided to other county departments and internal audit is a part of administrative services. For 20 years, we've always included, so past practice has always been to include 911 as a part of, as a part of that pool. And I think we've done some good work over at 911, looking at that staffing, looking at cash controls, looking at data security. So, I think it's a change to my perception. It's a change in past practice.
So we've audited them before?
Yes.
And in those instances, the audit was invited in. It's a service they could choose. It's like a menu they could choose. They use our HR to help them with HR type matters. They use legal in a kind of general legal counsel setting. But we don't impose ourselves on them. They come to us and say, we need you to help with X, Y, or Z. And we provide that type of assistance. So if they want to have this audit, they have every ability to do it. But I don't believe the auditor has the ability to impose that service on them without their will.
I think the difference is that between HR and other services is that audit is supposed to be independent, and the audit committee is supposed to come up with risk, and then the auditor determines risks, and that's just part of the practice of auditing, that it's independent of management, that it's not at the direction of management.
Next questions.
So we've done it every year, or how often have we been doing? the
We've
audits?
done 3 audits, I think, of them. One was. We've done one that looked at compliance with the Oregon Consumer Protection Information Act. That's what I was referring to, data sharing. I think we've done a couple of cash handling audits, and then we also have done a staffing analysis, and that's over our 20-year history. So it's not necessarily that we do it on a regular basis, although we do try to reach out to each department on an ongoing basis, usually about an 8-year cycle, to do kind of an overview of administrative practices.
And was there one, forgive me, not knowing, being new,
Yeah.
the new guy, is there one that's scheduled?
No.
And are we going to schedule one? Is the plan to schedule
I
one,
don't
or are
think
we
it
not?
makes sense to schedule one unless the code applies to them.
Okay,
Or if they want, or if they allow it.
okay.
I mean, and that would not be an audit, that would be consulting services, which we can also do, but that's a separate process from audit.
What type of risks is the county exposed to as a result of the 911 system audit? Right.
Well, what did we talk about? We talked about, and I don't think it's what kind of risks is just the county exposed to, but what are the users of the 911 district? So I think, I don't remember what we talked about. I'm sorry, I was kind of on the spot. I don't remember what we talked about last time, but.
There's some complicating factors there, and I think that's one of the reasons why in the past it's essentially been when 911's requested those types of services. The user agencies are any number of other jurisdictions. They're every fire department in the county, they're every police department in the county. They're COCC, there's other entities, I believe the hospital even has a reach into that. And so for their data and their information and their operations and their way of doing business to come under the purview of the audit being undertaken at the request of the county auditor and not at the request of 911, of which they have membership in that governing body, they're not gonna be real comfortable with that necessarily either. For instance, the city of Bend, I can't imagine the city of Bend would want the county's auditor getting into their business kind of through the back door of a 911 audit. They're not gonna be happy about that. And so I think historically, that's why 911, when they reach out and ask for audits, or if the auditor suggests one and they say, sure, that makes sense, then I think they can rely on that MOU as a basis for doing it. And I'm not sure if Nick or anyone understand. I don't know if they're billed separately for that when that has occurred, or if that's just part of what they are paying already.
It's just an internal service.
So in the past, when we've done audits of 911, has it just kind of been inadvertently, no one realized that they weren't a county department, or was there actually some discussion about proceeding under the MOU, or how did that happen?
I can't speak to that. I don't have knowledge.
I don't either. It predates my time in this office. It could very well have been that David Gibbons identified something that he thought in coordination with the director, let's take a look at this, and they mutually agreed to do so, and then it was a couple of months ago that this issue was identified here. That's before us today, and we recognized that we had a difference of opinion, and we really came to light about how different the service district is than a county department. And then, of course, the question is how this applies in the MOU, the 2010 MOU.
Is MOU a part of the contract or?
Yeah, it's the agreement that they have 911 with the county to provide, certain services, so they don't have to provide those in-house themselves. And it is, 911 is very unique. I mean, I try to remind people all the time, they're not a county department, although they are treated very much like a county department, but they are not. They have their own finances, their own tax base, their own insurance. They're not part of the county's insurance at all. They are completely legally separate, even though functionally, obviously, there's a lot of involvement with the county and whatnot. But they
So
are
can
separate.
you remind me then, when we bought the building down in Redmond, the Kingwood building, and they have, 2,500 square feet upstairs, did 911 actually pay for all that proportionate costs involved?
Sarah's behind you shaking her head.
Yeah, we paid for the entire remodel, everything that was done.
But you did pay for the building purchase though?
Yeah, the county did, you're right.
Yeah, we paid for it. Thank you, Sarah. I knew you'd know.
Yeah, I don't know.
So I'm going, where's the consistency? If they're really that independent, you would have thought that they would have had to pay for their portion of the square footage in that purchase. Cause,
Well,
I love.
They pay rent, right?
Yeah, they do.
You pay rent.
The indirects for the property.
So I guess the question is, do we want to do an audit? And if so, how do we go about it? Is that where we're at
No,
right now?
I think the question is really broader because it's, what is the audit committee's risk assessment include? And so, as we're looking at the universe of risk, should we include risks that we see in 911 or should we not? And it really can't be at the discretion of management. That independence of this committee and the audit function to determine what to audit is really paramount. And so while we could do consulting services for them, those wouldn't be an audit, and then there just wouldn't be that audit oversight, that assurance. The 911 wouldn't fall under the same assurance and oversight that this committee provides.
And I'm sorry, when was the last one done? I'm getting old, I can't remember.
Online to tell you. Wow. Probably has been a while.
It's been a while.
So the
So,
last two I recall were the ones that they were doing countywide to all the departments. So we got
Okay.
brought into the cell phone one for the stipend for the cell phone. So they hit I believe, all county
Okay.
departments, including us, as well as the cash handling was all county departments, and they reached out to us as well on that one.
okay,
And those are the two I remember when I was in my position. I don't know
okay.
otherwise.
So we did the personal information data privacy in 2023. That was countywide, so that
That would
was.
make
So that would have been the last one that we did. in
Yeah,
2
and we
years.
did a cash handling in 19, staffing analysis in 14, and we looked at countywide gas card purchases in 08.
So I guess the question is there enough risk that we feel we need to do another one? Is that?
Well, I think we need to decide, I don't know that there's anything for us to decide, but I'm just pointing out that, we can't even assess their risks unless they fall into that pool.
Is it fair to say that generally the fact that they are not a county department really limits county's liability as well? I mean,
County has no liability for 911.
Right, so-
911 is a separate legal entity. So they carry their own liability, their own risk. I mean, I suppose they could sue the county if they think some of the services they're buying from us were performed negligently or whatnot, but I don't see where the county independently has liability based on the operations at 911.
So what about that case a couple of years ago where I believe somebody died?
Yeah, that was handled through their external insurance
And
company.
you guys didn't do anything with that?
We just monitored it like a general counsel would. We were kind of the go-between between Sarah and her team and the outside lawyers and special districts of Oregon hired to handle that case and then ultimately settle it. We don't act as litigation counsel, for instance, for 911 because they have insurance through special districts, and so special districts handles their risk and their liability. We just do sort of the base general in-house type things.
But we do the sheriff's office.
For liability? Yes, yeah, they're part of the county's, risk program and self-insurance and the excess insurance and all that.
So I'll say, would it make sense to remove this from the work plan and add something else that?
We don't have it on the work plan right now.
Okay, we don't.
And so do we need to put it on the work plan?
Or do we need to put it on? It's not on.
I think we need to follow Dave's advice and not. You know, it doesn't sound like we can do it.
I think you can put it on your work plan. I don't think you can compel it unless 911 says, sure, come on in and do it.
Right, if we can't compel it, if they don't want to do it, then let's not put it on the work plan, I think.
It might make sense to look at something more internal where there would be risk that would affect us rather than.
And I guess I would question though, listeners' point that contractually they couldn't agree to an audit. I don't know why, if they wanted to have you come in and do an audit.
It wouldn't be.
With all that an audit
It
involves.
wouldn't be an audit, it would be the consulting services.
But it would be consulting services to perform an audit. I mean, they could give you contractually that agreement if they chose to. They could say, hey, we want to hire you to come in because you're an auditor to do an audit of this topic of us. And in theory, that could be agreed to and work out.
That would not be an audit because they would have been determining the scope. And so it would be a consulting service instead of an audit.
But in name, but you could do it exactly the same as we always do it, if that's.
Except
what they
it
agree
wouldn't
to.
have the certification that it was an audit on it.
You're just there in an advisory capacity, providing recommendations. Yeah.
And that didn't follow those independent standards or that this project came out of a broader conception of risk. And then we also wouldn't be able to say this was the most important thing to look at 911. This was the thing 911 wanted us to look at. Because sometimes people say, oh, look at this, because they don't want you to look at that.
Well, I mean, by that same token, they could contract with you to come in and independently determine areas that could or should be audited. In which case you could do an audit.
They could,
in that context,
and
yeah.
then I probably would say, but the audit code had to apply.
And if they contractually agreed, then it would apply.
And the previous audits were done under the same circumstances. I mean, they weren't a county department then.
None of us
Correct.
are
So
here to say how those were done.
I know, but
None of
the same circumstances existed, so it wasn't done as a county department, and so therefore it was not an
I
audit.
guess I did ask the former auditor who said no claim was ever made to him that the code didn't apply. So he proceeded as if the code applied.
Right. But it didn't, if it didn't apply now, it didn't.
But now we know, and so
But
now.
that was done, that was an agreement with 911, which is really a contract. Even and it was done exactly the same as audit because we didn't know. Anyway.
Do they do their own audits? I'm sure they have internal audits themselves.
Yeah, we have insurance audits, we have CJIS audits for our data, we have, we're accredited for our policies and procedures, so they come in and audit that every 3 years.
Are they willing to share? Should we wanted to see?
I don't see why not.
Unless there's a law enforcement piece with CJIS or whatever.
Right.
It's public documents, so absolutely.
Oh, yeah, we do our financial audits.
So would it be fair to say we could approach it that way? Ask for a copy of their internal audits, see if there's risk or if there's findings.
I guess you all would be welcome to ask for those things.
Or to flip it back to that question of the department, if Sarah wanted to say, come in for a cash handling audit or an integrated audit, which is already proven out as a process and you have it, you have that down and you could go in and do that cash handling audit or integrated audit, call it an audit at the end of the day, right?
I have to think about that. I'm not
Because they're not
sure.
setting the objectives, you still are, you already have those laid out.
That one, as being sort of a packaged result, audit that we do regularly, that might be, I'd have to think more about it though. But if they came in and said, you know, we want you to do a staffing analysis, I could do that, but not as an audit, that would be a consultant.
Interesting. So what do we do?
We're back to the question with all the
I don't know
information.
that there is anything.
Is
for you
raise
to
the
do.
motion on the floor.
We've got an explanation, let's just.
I would just say that if there's something we're concerned about, then and if we can get if it's public knowledge, we can pull the information publicly anyway, if there's something they want to find out, or if they will come to us and say they want consulting services, because it wouldn't be an audit. Technically, then we, you know, Elizabeth wanted to do that or felt like we could have that discussion, but I would just say at this point, not put it on the work plan.
And that communication can be ongoing, and keep in mind, the governing body of both entities are the same.
Yeah.
So, you know, there's a lot of familiarity there.
Yeah. Yeah. I would just, my recommendations, not at this point, put it on the work plan.
How would you do that? Any comments, questions on that? Is that okay? Just not put that one on the work plan? All right,
I agree with it.
any dissents? I guess they would not agree with it. Let's speak up. Anyone on the Zoom? Jody or? Okay, hearing nothing, let's take that off it's not on the work plan, let's not put it on the work plan.
No, and this, you know, agenda item was for you to have the chance to ask questions.
Okay. We did that.
All right.
All right, let's go up to the sheriff's office body and auto can.
Yeah, so, the audit committee, had audit, on the audit plan to look at, body and auto cameras. So we put together a methodology to, answer our objectives related to that. We have 3 objectives that we're not, able to do because the sheriff's office doesn't want to share, doesn't want us, allow us access to look at, a random sample of body camera footage. And those are to determine whether deputies properly record interactions contributing to community trust, determine whether deputies properly categorize recordings leading to proper record retention, and whether supervisors adequately monitor deputy reportings and categorization. So we're really not able to achieve those objectives without being able to look at the footage. The sheriff's office had stopped communicating with us, but the last communication we had said that they weren't going to allow us access because it included criminal justice information. And that the state has requirements that only employees with a need to know should have access to criminal justice information, but couldn't point us to any definition of what a need to know meant, or why auditing could, or that a need to know was specific to a specific incident case or investigatory purpose, or why it didn't fall within, why auditing wouldn't be included in need to know, and why the data wouldn't be included in our access to information according to code. So that's where we stand. So the next steps would be, for when we write the report, we write it up with a scope impairment saying we couldn't draw we couldn't draw conclusions on our audit objectives, on these audit objectives, because we weren't allowed access to information.
Okay, do we want to hear from the sheriff's office? I think they're down the line
Sure.
or on the Zoom.
I actually sent Jeff a note just to see if he was here as an attendee or to provide feedback, and it sounds like, well, Jeff, I see you in meeting, go ahead.
Jeff there?
Sounds like Jeff was attending to try and monitor for any follow-up items, but he's not able to provide feedback from the decision-making process. Okay.
Thanks, John. To what extent does this impair the audit?
So they talked a few other options. I mean, I really cannot draw conclusions on those things without actually seeing the camera footage. Some other options we had talked about was that, their staff could review the footage and tell me if they complied, if they could have a checklist, but I think that, removes the independence. You know, there would be no way for me to independently verify that those things happen. They could redact all of the criminal justice information, but that would be too costly. They aren't able to and reasonably able to do that, which makes a lot of sense. And then potentially there could be reports that I could review that might show, you know, when recordings were uploaded or who had accessed them or what categories. It'd be hard to do categorization without more context about what actually happened. But they don't have reports available either. So none of those options would work. I also asked for Dave's help because I think one of their concerns might be that they might get in trouble if they share it with me and violate, but Dave wasn't able to help me work with them either. So I sent them my questions and I just haven't heard anything.
Is there any independent agency or any other agency that reviews body camera data or stage or?
It's their data. They keep it on site. They don't share it with anyone else. And a question like, do auditors see criminal justice information? And the answer is yes. We actually have policies in our standard operating procedures of how to handle criminal justice information. And we've seen it in the past. We've done audits of community justice where we've accessed criminal justice information. I've accessed criminal justice information at other entities that I've audited. I did a DWI audit. I did a gang enforcement audit. I've done a intelligence gathering audit, all where I was trained and to view criminal justice information and keep it secure. So it isn't information. There's a history of auditors reviewing this kind of information. I've reviewed it personally. The office has reviewed it in the past.
In Oregon?
In Oregon, this office, the intelligence gathering and gang enforcement audits that I did were here in Oregon. And those were actually seeing state data, and this is not state data, this is just Deschutes County data. So it has nothing to do with, there's no tie-in at all with federal or state data.
So we're anticipating potentially still hearing back from the sheriff.
When was the last time of communication with them?
I communicated with the sheriff earlier this week. No response. I've never gotten a response to this question.
Exactly who?
I have been contacting William Bailey, and then I have copied Aaron Wells and Ken Vanderkamp. And then I reached out to the new sheriff as well. And
Just no response.
no response at all.
I'm not gonna jump in defense of the sheriff's office, but I will say, I know that I've spoken to Sheriff Rupert a number of times. And he's the volume of requests to him over the last 10 days has just been monumental, off the charts. And he's trying to deal with the search and rescue of the people of getting his feet under him in the office. He has, so I'm not surprised that he hasn't, and literally the only time that I've talked to him, like the county employee breakfast, I haven't, or if he's walking down the hall, I've sent him some emails and he hasn't replied to those either, or I haven't called him, but I am sympathetic to the situation he's in right now.
Yeah, Mr. Chair, yeah. I mean, yeah, put it in context, remember, we just had a sheriff leave in disgrace and we appointed a sheriff a week and a half ago. So I mean, this is kind of like a black box that's just starting to figure out which is up right now. So I mean, these are facts as we know them, but yeah, right now probably is the time to get an answer.
Yeah. And his captain's report to him. So if the captains aren't here, maybe because they didn't receive a direct go participate. It just, I'm giving them some grace. That's me.
An option would be to put the audit on hold. A reason to not do that, and the reason I decided not to do that is we have other audit objectives to report on, related to public records requests, IT security and reporting. That's information that will go stale if we hold off. So I think, you know, my plan is to go ahead and report this with the scope impairment. If you all, want me to do another audit specific, where I could draw conclusions more on the footage, then we could do another audit at that point.
So you would just put the body cam audit on hold, but proceed with the rest of it?
So it's the body cam audit, and report that with the scope impairment on these.
Can't you just put that on hold? Because it sounds like that's gonna be a waste of time. Or no.
Sheriff, time to get on board.
Because those were the objectives, so I have to follow through with what happened to the objectives.
I would say probably just go ahead and complete it with the scope impairment at this point in time, and then go back and if we can at a later date when he's got his feet under him, do the body cam audit.
What are the ramifications of that? Are there any, just what? The scope impairment, it's just you can't do the work right now because you're not getting information. There's a reason for that potentially, based on your leadership or.
I mean, I don't think there's a reason for it. We've had access to this information in the past. We talked to them throughout the planning process. We thought we were gonna get it. It wasn't until we made the request that we were told we weren't gonna get it. This has been going on a long time and it's not, audit started before the sheriff was,
We've been told we're not gonna get it, but we sort of waiting for an explanation as to why.
we got an explanation. It just didn't make sense.
Oh, okay.
So, how long ago? Like, was it, you started it 6 months ago? I'm just wanting a cleaner timeline because things have been, out of sync there for a while. So, you know, I just sent him a text. that
Started in February, maybe,
This year, February.
yeah.
Okay, so I think February, they already knew there was things coming up.
Oh,
So, yeah, so that could really, be impactful.
Eric has something.
I just wanted to ask who that explanation was from and what was the general nature of it?
From Captain Bailey, which was based on some information he got from the state police, information officer. It was referencing parts of the state's CGIS policy, which didn't really apply, information about access controls and what level of privilege should be assigned. And I was only asking for read access, so, you know, not to manipulate, documents, and then also, the account management guidance was just defining types of accounts, like some accounts should be for managing, some accounts should be for monitoring, but it didn't really say like any reason like why there shouldn't be some kind of account established for auditing. Monitoring might be an applicable category. And then the reliance on the definition of need to know, which without any definition provided. And I think there is a broader question, which is, should the auditor have access to criminal justice information? And I think the audit code says that the auditor should have access to criminal justice information when needed to answer an audit objective, and no explanation has been provided for why that would not be the case.
So they knew 6 months ago, they saw the objectives of the audit 6 months ago?
I didn't, actually, this might have the date that I made the request. I made a request on my sort of like, May 27th is when I made sort of like the most direct request to them. And
Of
that was-
25 this year.
Yeah.
Okay.
And then that's when they responded on June 11th, that they wouldn't provide it, and since then I haven't heard anything from them.
2 months.
2
Jody,
months.
You got something? Throw your hands up.
Yes, thank you. A question I have, and this may not be applicable, it may not be a thing, but I know like police and cops oftentimes use the term like CJIS. Is there a way for like the audit division or you to become like certified to be able to see that information, right? Because it also feels like this might be a barrier today, but ongoing potentially as well. I don't know
Yes.
what that entails or if that's a possibility, just
So when
thought I'd throw it out.
When I've accessed information in the past, it involves is an extra background check, an extra criminal check, so being fingerprinted. And then going through a training, which I've been through, which I could go through again. And I offered to them that I would do that, but they said there was no need to do it because I shouldn't be having access anyway.
Makes absolutely no sense. I think there needs to be a conversation somewhere. The department.
With the new sheriff coming on board, it might be a good time for that.
Yeah,
It's a perfect time.
yeah. Can we hold up on completing that until maybe that conversation happens and we get a better read? Is that okay?
Would it maybe make sense for maybe Patty and Daryl and me to meet with the sheriff to have that conversation?
It's
fine. Yeah, we can try to.
Yeah,
set
let's put it on hold then for just a little bit until that conversation happens and see what the result of that conversation.
Okay.
I mean, maybe there's a chance to break through and not,
Yeah.
in the end, not have an impairment.
Yeah.
At least give it another chance.
Okay.
Especially when you consider the political situation of the trauma of this year, and if we could smooth that out, I think that would probably be incredibly appropriate.
Okay, I'll reach out again and see if someone can meet with us. Do you know who, like?
I said, Captain Root, our sheriff,
Okay.
a text message, and he's usually excellent at getting back to me.
Okay.
So he hasn't yet, but we'll give him a few more minutes.
Okay.
And he'll be like, oh, the phone will turn red, it's from me, right? We need help here.
Yeah, let's have that conversation.
Okay.
See what we can do, especially with the new administrator or sheriff.
I know, I was calling my captain.
I know. Don't wanna call him administrator.
No, not minister.
Available week of the 18th, I think it is, August. Just throw that out there.
Okay.
Off the grid.
Nice.
Okay, so we're going to hold off on that one. And a May 2025 election is the last one.
This one we got a little bit more talked about last time since Steve was here, but it's related to the elections audit. There's also a lot of copy down the objectives specifically, but you know, we're also looking at different process. We're looking at how voter rolls are maintained, and we're looking at how ballots are adjudicated, and we're looking at drop boxes. So we're looking at a bunch of other things, but one of the things we wanted to look at was information security, specifically related to the clear ballot system, which is the system that tallies the votes. This came up as a high-risk area, met with members of the public, with the Republican Party, the Democratic Party, and the League of Women Voters. The League of Women Voters and Democratic Party were not very concerned, but the Republican Party was highly concerned about it, about information security in the system. So added an objective to the audit to do just our basic IT security review. of that system. This is a similar system, we're doing a similar review of Sheriff's Office body cam information system. That's part of what we were able to we're actually able to draw conclusions on. Steve mentioned that he didn't want to share it, citing a state law that requires him to submit a security plan, which includes an information security plan, to the Secretary of State's office. That requirement exempts the plan from disclosure, public records request disclosure to the public. And so he cited that as a reason he didn't want to share that plan or talk to me about information security on the clear ballot system. I mentioned to him that this isn't a public records request, that I'm making this under the audit code, that I can keep it confidential, that wouldn't necessarily even report on it, work with county legal to decide what was disclosable and reportable. But even with that assurance, Steve is uncomfortable with sharing or discussing the clear ballot system. So that's a scope impairment on that part of the audit.
Okay, I know we heard from Steve last time and probably nothing's changed.
Well, I have plenty more to say. I mean, there's a lot of nuanced detail to that too. What clear ballot is and where it resides and how it is protected and what has been shared, it hasn't been. I won't disclose that we're using that system. One, it's a state federally certified voting system that's here in our office or down the hall in my office that is protected. It's not connected to the internet. It's not connected to Wi-Fi. It's not connected to the county network. If it were, then county IT would see that. So it's not. There's many checks and balances. You know, Elizabeth knows where our cameras are. She understands what our access is to that room. She understands what it is. So to just blatantly or to go out and say that I drew a line and say I'm not going to talk about it, that's not entirely true. So I am willing to talk about it, but there are key components. I can't allow anybody else to have access to it, and I can't share Windows logs and things like that. That's an entirely separate system. Being state and federally certified and configured by our vendor is something that I can't give access to anybody else. And the cybersecurity piece of that plan is more county too. I mean, there's a lot of information on there that's against the county IT security. And giving that document to anybody would compromise, potentially compromise and give anybody bad actor, here's our blueprint. And you can imagine here's the answers to that test for any bad actor to initiate any methods that they wanted to. The county security plan, and if you probably glanced at it, Elizabeth certainly has, it's pretty straightforward. I mean, it's a list of our drop boxes. It's acknowledging we have agreements with our vendors, and there are other pieces and parts in there, but ORS 254074 is one part of it, and so there's a corresponding OAR as well that's very similar. Point being, there are pieces in here that, you know, it's fairly benign. I'm happy to talk about it, but when it comes to actually accessing some of the very critical system information, I can't do that. And that's not me going out on an entire limb either. You know, I've consulted with my association and that executive board, and they concur. They wouldn't hand that over to their internal auditor either. So I haven't gone rogue. I've consulted with the Secretary of State's office. They defer back to me. So again, it's not going out on a limb, and I have a lot more to talk about if you guys want to engage in a conversation about it.
But generally, it sounds like you feel that the risks of allowing access to that system outweigh the benefits of an audit of the system.
So yes, and maybe that just goes back a little bit to what is the audit? What is the scope of the audit? Saying that I need access to a couple of pieces and parts of that system to prove that you're compliant. It's
I didn't ask for access to the system.
the Windows logs or whatever, you know,
To
the-
see the checklist of how, who's been accessing it. Because it's really looking at user controls, to see who, you know, has everyone who's accessed the system, have they been certified, should they have access? Do they have the appropriate access? Are there appropriate segregation of duties within the system, which we also talked about earlier? So it's not like I'm gonna go in and get access.
But Steve, you think even just disclosing that information could compromise the integrity of the system?
Potentially, I mean, that's, if having that list of usernames, maybe not passwords, but even just the usernames, that's part of it. But disclosing any of that is, you're opening yourself to risk for every piece and part that you provide. And for something that I consider protected, you know, under that disclosure, and I understand, you know, the definition of that public record may be the stretch, but I just, I'll guard that, I just guard it.
So how is then that system audited, or what's the quality control for what she was asking? So knowing that you have a list of people who have access, and then looking at the quality control of that, do they have the right to have that access? What certifications do they have? How is that done then? If Elizabeth wasn't doing it, how is that get completed?
That's a fair question. And again, rolling back again with elections, for every piece and part that we conduct, there's a check and balance to all of it. It happens up front with candidate filing and our proofing and our ballot creation and creation of our voters pamphlet, and ensuring that every voter gets the correct ballot, and that you get one ballot, and if you receive the second one, how did that happen and what happens with the first one? Anyway, checks and balances throughout. That certainly doesn't stop once we receive the ballots and start tallying and putting them through our system. All the way through the process we've had, once we receive ballots, and not to get into the minutia, but I also wanted to open it up once again for a tour. You guys can come down and see it, watch the process, and you could better understand exactly what I'm guarding, what I'm willing to share. And I think you'll find that I'm willing to share most all of it. But once we receive a ballot and we deem it to be that we can tally it, it's a part of a batch. We know how many ballots are in that batch. We know that we've, you know, if there was a certain number of, there are a certain number of ballot return envelopes within a batch. Maybe some of those are empty. Maybe they have multiple ballots. Maybe the things in there that aren't ballots. We have to account for those, and ultimately all these ballots move along to be tallied. We need to know what that number is, and our control sheets that follow that batch let us know that. So that once we report that number, I know how many ballots were in that batch. But to more directly answer your question about how do we know that it's working, we have our audits, we have internal audits, department audits, and that every election will run multiple tests to certify our voting system that it's tallying the way we expect it to. We call that either a public certification or a logic and accuracy test. And we run that test at least 3 times each election. And what that is we're verifying each ballot style, each position on each ballot style to ensure that the voting system is tallying the way we expect it to. That gives me confidence that the system's working the way I expect it to.
So that's your internal audit process. Do you ever have an external audit done by somebody who's certified to do so?
No, but I have more audits, sorry.
Sorry.
Hand counts, each primary and general election, the state will prescribe a certain number of batches or certain batches, say, take these batches and hand count these races. So we'll go and pull those batches and hand count those races that I don't know which ones are going to be asked. They're entirely at random. Again, validation. We have, if we have a tie vote, we'll have an automatic recount, or if it's within a certain margin, we'll have a hand recount. Same thing, going and pulling those ballots. It validates the system. It validates what we do. It validates the process. And I've used this example before, and I know Elizabeth knows it, but State Rep 53 primary election in 2018. Jack Zika, Ben Schimler, 7,500 ballots cast. At certification, when we certified the election results, that was separated by 2 votes. That was us using that voting system to get to that result. And not having any idea, of course, going into it, that it's going to be that close, entirely random. that obviously triggers an automatic hand count, so we go in and pull all 7,500 ballots out from every batch, every box. Reassemble our election board workers, and they take those 7,500 ballots, first count, does that count match what our tally system said it did? And it did. Then hand count each vote for each candidate, and it came up at the end of that by to that same two difference. Validation to me, again, to for me to know that our system was doing what we thought it was, and that humans doing the same hand count get to that same result. So but that plan that we submit to the Secretary of State's office, we submit it for approval, and it's approved annually. It has each of the components of that requirement and that ORS, and they send me that approval letter. That's just another piece of the process, but somebody coming in and putting their hands on the system from the outside, no, I don't have that.
Because they approve your plan, but they don't look at implementation.
Looking at the implementation of the plan, again, part of it being drop boxes, they gotta come out and look at our drop boxes. So,
And I'm thinking specifically of the information security, and I also don't know what's on the plan related to information security, but. And I think to Liz's question was, is anyone coming in and like auditing your user logs, auditing your permissions, auditing people's training, auditing those kind of things?
no, but I'd also add that we have had multiple assessments done by Homeland Security here on site, walking through our facility, which has been helpful and beneficial and to ensure that our facility is secure. We have another piece of this will go back again a little bit, but elections are considered critical infrastructure with Homeland Security. So you know, something that is protected and that information. I have there's a state directive from 2022-3 that basically further complements what this ballot security plan statute refers to, and that protects the security of our systems. And I'll provide you a copy of that as well, because it's it does mention it as a public record, or as it applies to Oregon public record, but it also highlights the security and the importance of protecting our system, keeping it safeguarded.
Do you ever worry about ballots being destroyed in certain locations? Like over at the fairgrounds, it's kind of in a bad spot.
That's exactly, and then there's one at the nursery that's
Yeah.
very unprotected.
Because working at the fairgrounds, I know there's only one camera. It's in the front. So you have to go around by the rodeo. And it's in a like a circles, a roundabout.
Yeah.
There's no cameras out there. And that, we have a lot of homeless out there. So I would think that's a really bad spot.
Appreciate that input.
Yeah, really bad spot for
I'm
that.
happy to talk offline about the ballot drop box locations and
Yeah.
how we choose them, and
It's a
maybe
bad spot.
maybe when we're looking to change one or anything.
So can I just real quick go back, and I try not to take up a lot of time for everybody, but so if we go back to, you said that you met with Democrats, Republicans, League of Women Voters, I think you said. What was their, did they voice like a main concern? Was there specific objectives or something there? And because where I'm going with this, if the public had specific complaint or objective, does the audit, is it going to address those things, even though we would have some scope limitation on that audit?
Oh, does it address those things? They were very specific in their concerns about information security. They had other concerns as well. And so other concerns, we were able to, we will be reporting on those. And so that was fine. And Steve's been very helpful in a lot of areas. And I think the audit's really gonna offer a lot of good information. But this one area concerns specifically about information security of the clear ballot system. There were concerns about that, and we were able to address those concerns.
Okay.
Like I said, I feel like you can, maybe not by directly seeing some of the things that you're asking for. But understanding that the system works and that our results have come out and our audits that we do conduct prove that from downstream from that, you can still see that the system is working and that it's not connected to the internet. Again, otherwise IT would be reporting on that and other checks and balances. You understand what the physical security is of that room. You understand that it's a certain federally certified system. So to say that you can't get to your conclusion, I think it's maybe a lack of an additional conversation or additional questions asked or more specific objectives coming into it, rather than saying, because the objective just says, you know, the security controls around the clear ballot system. Well, there are some, and I've just discussed very openly others, but there's some granular detail that I'm not willing to share and I can't.
So we're using this checklist that we use for all of our audits and our integrated audits, and we used it on the body camera audit, and we used it on the health benefits audit, looking at things like who are the users. We used it on the RV audit. Who are the users? What kind of permissions do they have? Is there conflicted in segregation of duties issues coming up within their roles? Do people's accounts get terminated in a timely manner when they leave the county? Or their role changes? Is the system updated when it's supposed to be updated? Is someone coming in and running the software and updating the system when needed?
So do you have a
What are
checklist of
those
questions?
Yeah, I did,
Okay.
and I provided it.
Okay, so are there most of those questions you can answer off the checklist?
So
Generic question.
yeah,
generic
some of those generic, most of them, to be honest, would be non-applicable. That list pertains to things that are on the county network, not something that's off the county network that's governed by other requirements, certification requirements. It's not to say that somebody's coming in and doing that regular update. Well, on the county network, it's plugged in and being regularly updated. This is isolated, so no, it's not. It's only when we get a new upgrade, a certified upgrade. There's different things from a voting system, the voting system to county network computers.
I would disagree. I think it's an information system security audit that is applicable. You do have users, you do have people log into the system, they're identifiable, they have passwords, this is such a timeout after a certain time of inactivity. These are just.
Have you reviewed the internal audits they've done?
She's running from.
What audits are those?
So our public certification, she didn't come. Our tie vote recounts, she didn't come. So those other checks and balances that we're conducting.
Those aren't specific to the information system though.
It's still proving that information system is working. So that's my point, is it does work, and our audits have proved that, our hand counts have proved that over time.
How many people are users on the system?
It's a handful, we're a small department.
Okay, and they all have training?
Everybody that,
And they all have
put anybody in front of those computers or in
Okay.
front of our system that would.
So that you can document, you can certify that they all have training, that they all certified users.
I will test that they all are certified right
Yeah,
now.
okay, so that's one of the questions, right? Is,
But then I would also want documentation of those things, so.
okay. Copies of classes or certifications that they've taken or something, do you guys have that? I'm military, so I mean, every little survey we take gets a little certificate.
But he won't even give me a list of who the users are, so I can't certify, like I don't even know who the users are in the system.
And is that confidential information?
Again, if it relates to the security, and I don't need to define that, I'm not gonna, I'm won't define that. All due respect.
Okay, so I would just say at this point, just
Go forward.
go forward and just list the scope, limitations.
And to circle back, I did hear from the sheriff,
Oh.
and he said, yes, let me know what your schedule is. So should I warn him and say, please bring your attorney and we'll chat? Anyhow, he said he'd be happy to meet with us.
That's great. I'll reach out to him and copy both of you.
Yeah, copy, tell him, I'm telling him you're gonna reach him.
Awesome.
They don't have any attorneys.
I know, that was a joke. See, they used
Oh,
to,
sorry.
they used to have their own attorneys, but because we're in a different frame of mind now, it's so better.
Great question.
Okay, move on. Other discussion items. Administrative updates.
I guess I don't have any update. No, I will need to step out for about 15-20 minutes. I'm not sure where you're at or at what point, but we're gonna check in with Sarah Crossfire earlier today, and then lo and behold, there was an accident. that turned out to be not my accident. I was coming back from Redmond and somebody had done that U-turn at the north end of town, stopped traffic for miles, and I missed my meeting with her, so we rescheduled. So I'm gonna try to navigate between that and the executive session.
Can we go back for a second? Sorry. While we still have the topic full of mind, it's top of mind. For the record, I just want everyone, the audit committee, that maybe only a couple of you have been here for a few last few years, but when this became when it came onto the radar, that was due to conversations that I had with Dave Gibbons, and I don't remember, maybe Aaron Key predated Elizabeth. 2020 came and went. Again, the same thing, you know, all of our audits checked out, it worked. But of course, there was a lot of narrative saying that it didn't. And that just kind of built up over the second half of 21 and all through 22. We had a lot of election observers coming here on site. Everybody welcome, you know, I'll provide a tour anytime somebody asks, be proactive about that. You know, just to try and be as transparent as we can. And after 22, you know, and I spoke with Dave in a way to further pull back that veil and say, how are we doing it right? Why are we continuously getting right? Why does Deschutes County have a good reputation? And from my predecessor and hers. And it's not coincidence. It's not coincidental that what we've done is repeatable. It's because we followed the law, we follow the process, and we're consistent. It's not to say we can't make a mistake, because we certainly can, but that I asked for this. I said, come on in, show you everything, we'll go through it. And you know, what I was thinking that it was more going to be on. I understood these internal audits to be more along the lines of what's in the county's best interest. What is best to build that public trust in what the county's doing. And I thought that would be a good way to do it. Other counties that have made mistakes in the processes that they do, whether it's scanning a batch of ballots a couple of times and reporting inconsistent results, or further up, making a mistake with the candidate filing, putting a candidate on the ballot that shouldn't be there, having a contest, showing up in front of voters in the wrong area. All those things matter too. And that's a cost to the county. That's a risk for the county. Hundreds of thousands of dollars spent and rework by other Oregon counties over the last few years, hundreds of thousands of dollars. And I thought that might be the type of risk that would be highlighted and tell a positive story of how we get it right. Say it. I mean, again, it's not coincidental. Let's take a look at the procedures that we have on that too. And I wish that this audit was going to be able to tell that tale a little bit more. And then the other part of the conversation was that we are running out of space in our office. We've been there for 20 years, and we make it work. We've got a lot of moving things back and forth, and everything's secure, but we're still, you know, it's not a very efficient workflow at all for processing of elections product ballots and envelopes and everything. I was hoping that this was going to be part of that too. That's what I had said a couple of years ago when putting this on the radar. The last thing I wanted was to plant any sense of doubt. And that's unfortunately where this audit went. Rather than telling the positive story of why we get it right and highlighting more of it, it would be a lot of task of Elizabeth to understand exactly all the pieces and parts. But I would have appreciated a little bit more turning it internal to ask more about me, or ask more about us and how we're doing it, rather than asking the external stakeholders as well. But there's a bigger story to say here, and the risk is a lot of money on the line for the county, hundreds of thousands if we make a mistake. And I hope we don't. But counties do every election, or risk of being sued or anything else too. So just more pieces and parts to talk about. This is a much bigger conversation, but unfortunately, this is gonna have give us a black eye, and it doesn't have to be that way. Thank you.
Report tells another positive story too.
I mean, I did a risk assessment, I mean, Steve's right, I can't look at everything. And I did a risk assessment, where I talked to other people, looked at reporting, looked at work that we've done in the past with Steve's office, looked at elections audits in other jurisdictions. These were the risks that rose to the top. These were the things people were concerned about. And I can't look at everything. I don't have time to look at everything. That's why we set a scope and objectives, specific objectives. I don't think anyone would say, information security is not really important to elections these days. I really just don't see a way around not having that, as an objective in this audit. I mean, even the way we, when we look at data, we're even supposed to do kind of a very surface level review of information security. If we're relying on data that comes out of an information system, we're supposed to look at an information security. So, and then I think it also speaks to the importance of independence and why it is important that our reports are reliable and that our reports aren't seen as being another way for the county to tell a good story. I mean, that's Whitney's office, that's the public information office. Our job is to look at risk and independently assess risk and come to conclusions. And that's what I did in this case. And I feel pretty confident about the objectives that we came up with. And, you know, I appreciate that there's a lot Steve's doing well that wasn't covered in the audit. We can't cover everything, and we're directed to look at the areas that we think are the highest risk, and that's where we landed. That's something we have to make a professional judgment about.
Yeah, other counties are currently being audited because of those same things that cost the county a lot of money. And potentially, you know, we're at risk of having those cost overruns and being sued for a lot of other reasons than just that one piece. That one piece is, again, well, I won't go around in circles, but there's a lot more to have looked at that would identify that risk. It's cost to the county as well, and it's as potential of being sued if we make a mistake.
I think we're all here to learn and get better in our jobs. I mean, I have a lot to learn at the RV park. I've been at the fairgrounds off and on since Elton Gregory, since 1998. I appreciate all your work. I've been a voter since 18, so I'm an old girl. I'm 64 years old, so I appreciate your work, and I appreciate everything Elizabeth does.
I've got some thoughts on it, and I have no reason to think that you're not doing a fantastic job, and your
Me too.
department's not doing a
Yeah.
fantastic
The
job.
hard job.
But I don't feel confident saying that this is, you know, that you can hang your hat on the public records request. I mean, and if every department head could come in and say, my department's doing fantastic, and I don't want to divulge information because I feel like it's, I'm concerned about the integrity of it. It would really impair our audit department. That's my concern.
You know, a lot of this comes from, you know, the process leading up to learning what that, what the scope actually was in late April, while we're in the midst of running this election. understanding what that real request was. There were other pieces and parts of this audit earlier on that had me concerned about if I did move along and in that vacuum that Elizabeth opened up to say, you know, I'll share it and it won't be disclosed anywhere, that I didn't feel comfortable that something might be found just to say, there's that, and now the report would come out and say, yes, there was something identified. And I don't feel that there could be, but I feel like maybe she would have found it. To say that there's something there that needs to be addressed, that would further plant that public doubt. And that's what concerned me. And that was because of other pieces and parts of this audit earlier on, where the scope was not defined, the scope was outside of my office, and there were little pieces and parts that came up that, quite frankly, you know, really concerned me about where this audit was going. And the types of questions, the types of approaches that I was not a part of. And I understand that maybe I shouldn't be, but there was quite a bit of this audit that concerned me leading up to this part. And had me have to put my foot down and say, I'm not moving any further with that part.
And that's a big issue too. I mean, the department heads don't have faith in our audit department. They need to, absolutely. So, anyway, those are my thoughts.
Then I can tell the story about when Les Stiles came into office and he knew there was a problem and he was doing financial investigating and it was huge. And he tried to work, I was told, with the county, and the county didn't want to have any part of it. So he actually went outside to the FBI and the prior sheriff ended up in prison. So sometimes you're not going to get that approval, perhaps. I'm not saying for this case, but I'm just saying overall that actually happened in Deschutes County. And someone I was talking to said, Patty, do they forget what happened here? And you know, then other people have actually, we've discovered, I believe maybe it was Dave Gibbons that found that funding that was another problem from one of our offices. Yeah, I mean, serious. So there's a reason why, and to have an independent auditor, I think is incredibly important. So that's kind of the other side of it.
I'd like to, I mean, if Steve could be more specific about what he's concerned about, because I mean, I think he's referring to the earlier part of the audit when I was asking questions and I was just asking a lot of questions. I'm trying to understand what risks are, and you didn't like the questions I asked and you were asking too?
No, that wasn't the case.
Okay,
I don't.
Was this though, this was the last year where we had, the state kept releasing numbers of people that were registered to vote that shouldn't have been. And so I think people were already hypersensitive to our election on a statewide basis. It wasn't in Deschutes County, but we had a few, didn't we?
That was I think you're referring to the motor voter, the DMV issue, that
Right.
integration with the state, that some potential non-citizens were automatically registered and when they otherwise should not have been, so. But yeah, that's.
So it makes everybody.
Yeah,
Way more
I would
sensitive.
agree, and we see it a lot in the media, right, where they're questioning the integrity of not you or your office, it's the system, you
Right.
know? Whether it's hooked up to the internet, whether it's on whatever, it's that hypersensitivity to how do we know as a voter that the integrity of this system is tight? That the information or the counting or whatever that the system does is doing it the right way, that the people who are operating the system are allowed to do so. I think that's, and being able, if you've got voters and groups asking that question, that just increases the hypersensitivity. So there has to be a way to answer that question. How do we know, if all as voters, that system is operating the way it should, and that the system is operating at the most secret, to use again a military term, so, but how do we know that it's operating and protecting that information and doing what it needs to do? And how do we as, or Elizabeth as an auditor, answer those questions without doing something that shouldn't be done? So we have to find a way to say, okay, we know that you know, the people who are using the system have been trained and are doing it and are not sharing, or the information can't be shared somewhere else. How do we answer that question in a way that's not gonna compromise what you need to do? So that's the question. How do we share that? How does she get that information from the audit? So that we can answer, or the county or management, whomever can answer that voter and say, yes, we have no doubts as to the ability of how this system is working. Not you, not your office, but the system itself. How do we do that?
Yeah, I mean, that's the $1 million question, sounds like, I mean, having the conversations, having the ongoing conversations, having the conversations that Elizabeth and I have had. And then, and as I do with the public all the time, like I said, I constantly, more than ever over these last 4 years, pulled back the veil and showed what we do.
Yeah.
And you may have seen it far and wide with the partnership with the county and PIOs, or the just allowing the media to come in and you know, show the whole process from top to bottom. But some of those very detail oriented pieces that are part of our voting system that I have regard. But I'm as transparent as I can be with most aspects, obviously, short of this ballot security plan and the cyber pieces that are in there.
So, and the cyber piece is important, and you know that, we all know that, right? That's the vote, the thing in the media, you know, what if we're not under attack? What if people don't have access that shouldn't have it? So if we proceed with it, just publish it with the limitations, but be prepared to be able to answer that question. Is how do you know, okay, well, this audit says that here's limitations to the audience. All right, how are you going to, or the county is going to address those limitations, and how are you going to be able to say, answer those questions, and that the system itself is secure? That's, you know. That's what it comes
Steve
down
asks
to.
that question all the time. I
Yeah.
mean, just continuously, all the time. And
Yeah.
we are fortunate to be one of 4 counties in Oregon
Yeah.
that has an internal auditor. 32 other counties don't have
Yeah.
an internal auditor to even ask the questions that we're having with the
Yeah.
committee today. And so Steve, I'm just gonna stand with Steve and just say he's doing a remarkable job. He puts so much effort into this, and not just during the election season, but all year long, every single day.
Yeah.
And
I think that
Just
just,
know
you know, if somebody wants to see the audit, you know, that's the question that's gonna come up if we have those limitations of moving forward. How do you answer those questions?
But actually taking it at 10,000 foot level, this is not reflective on Steve, but people leave Oregon and they leave it by death, or they leave. And once, this is really a state issue, they don't care that they're still on our voter rolls. I just heard about some kids that had moved to California and they're still on our voter rolls. And I said, okay, to my friend, you've got to come into the office and fill out some form, but people that leave, honestly, they don't care. So
Right.
there we have them on our voter rolls, or we have a death. I called somebody last November and they had died. Somebody answered and they died 5 years ago. So I immediately tell Steve that, because I want our voter rolls cleaned up, but that's how bad they are.
Yeah.
Because like people leave and they don't care.
What we do, I care, I care.
No, but the people
I know,
leaving
but
Every
they're-
single-
you don't care.
You know, if the person leaves and doesn't care,
That's-
it's bad,
that's-
but
that's
we mail them a ballot.
Yeah.
And then their
Right.
ballot, they're not where they said that they were when they were registered, and that let's come into my office, we can do this all day long, but it comes back to us as undeliverable, then they're inactivated. And that's one piece of our voter rolls, but it's constant, it is fluid, we're doing it right now, we're checking obituaries, we're
Yeah.
getting lists from.
And I think
Patty,
seeing the
I-
process,
we-
it's
we
not a
did
question of
hear
your
those
process,
concerns.
it's, again, it's that system, it's that cyber system, right?
Yep.
How do we, where's the verification that it's doing what it's supposed to do and keeping information secure?
And-
That's what it comes down
and
to,
we-
not you and
Yeah.
your
Our
office.
concerns about the voter rolls, and we did develop audit methods in order to
Yeah.
look at that, and we will report on that, and.
Yeah.
and
I
see-
think
see, you know, that's one of the areas we can.
Oh, good, that's great. I appreciate
Yeah.
that, because, you know, that's my personal experience.
When the audit comes out, we will be able to add more assurance
Right.
of how that.
Yeah,
process
I would
works.
just say, let's just go ahead and get it done with the limitations, and then have either additional information or have answers ready in case there's questions.
And one more thing that I've offered to Steve, and I hope he appreciates this, is, you know, if he is concerned about, I don't wanna open up the county to risk too. And so, you know, if my going in and checking the IT controls somehow exposes you know, some master thing that can crack, we can keep that out of the public record. And so just because it's in the audit and we've made our conclusion, doesn't mean all the details are in the report. And so, that's another thing that I shared and would talk with Dave about, you know, is there an exemption or reason why this shouldn't be in the audit report?
What are our options if we have, because Steve, you're on the committee, if there's another instance that comes up later, and there's a department head says, I'm just not giving something. I'm not giving something.
Yeah.
Wouldn't we go to the commissioners and or what?
The code says we can ask, county council to, assist us with a subpoena. But I think before we went there, I think we had a conversation.
Yeah.
But Dave has been involved and he says he doesn't really have an opinion on whether or not I should have access to this information or not. So he's not, I don't think that would be an option in this case.
Okay, yeah, I was just wondering.
And just one more piece about this document that's been talking about the sensitivity to it. It's not something that I'm emailing around either. This is something that once complete, I securely transfer it to the Secretary of State's office and they may email me my approval back, but that's just a cover saying that we're approved. Again, the level of scrutiny that's on elections these days, and then the level of care that we take with the security plan and being mindful of not to overshare it. It's this backbone, and then once again, it's not only my personal opinion and take on this, it's my associations that they would have the same conclusion. So again, it's not me going rogue. This is a story that we still need to tell. How do you build that that confidence that our systems are working the way that we say that they are, without jeopardizing the integrity and security and that sensitive information that's in there? Again, $1 million question.
Yeah.
But we work every day at that.
Yep.
Okay. Let's move on.
Sorry.
It's okay. Thanks for, no problem. All right, so we have an executive session item we need to do.
Yeah. So we're gonna go into executive session under ORS 192-66021, which is there to review and evaluate employment performance. It's the annual performance review for the county internal auditor. If there are any members of the media here, they can remain, but everyone else should excuse themselves during the executive session until the meeting comes back into session. I am not sure
Who's on Zoom?
how to stop the recording so that Jody and Joe can stay. I don't have, maybe I'll go grab Angie.
Yeah, we'll hold on.
I'll hold on. Thank you for coming here.
Thank you for input.
I know she said it was important, but I don't see the.
I don't see the little red dot or.
Well, I hope it was.
We'll make sure.
Take it from the top?
Yeah.
So, your keys, I almost took them. It's kind of like mine.
I have no idea what they're all for. I just try them until one works.
I can imagine.
For trading, Patty?
What?
Trading in, trading up,
Trading what?
trading your vehicle.
Well, no, I love my pickup. I saw his keys and I was like, oh, see, but they look kind of like mine, except he's got something heavier.
Like, we should have Elizabeth come back in.
Because she's too.
You want to go get it?
Yeah, if you would see, that'd be great.
Yes.
Yeah.
Oh,
That's what I'm saying. So I tell her, I support. Okay, so I do.
I don't think we have a special meeting. Do it at the next audit committee meeting in October.
I don't know if there's anything.
Is it in October?
I think it's in October.
Okay.
There's no, I mean, her step, that is done automatically.
Yeah.
I understand.
Right.
There's no
urgency, yeah.
no reason to, so we'll just put this on the agenda for October.
Cool. And we are gonna turn these back in to.
That'd be HR.
HR.
Just, or you could. I guess you could give them to me and then I can get them to HR and kind of coordinate it.
How do I get it?
I don't, whatever works best, maybe better for them to coordinate it, since I,
You should get Susan's email from. Do you have
yeah,
Susan?
I'll send everyone Susan's email.
Okay,
so we can do.
thank you, thank you, Brenda.
This is.
Bye. Goodbye, Bill.
Bye.
Is that Bill, right?
Yes.
Yeah, yeah.
Yes.
Phil didn't have anything to do Friday, even though he likes the audit committee.
Nothing like an audit committee.
Used to ski, but it's summer, so. Thank you so much, Daryl. Thank you for
Yeah.
Thank you, no, thank you for serving on this.
Yes, this was an interesting.
Were you in the
one.
army?
I still am, National Guard, yeah, I'm actually retiring in October.
Oh, congratulations.
Yeah, finally.
Awesome.
Yeah.
What are you gonna do? Are you gonna work at all? or-
Oh, I do, I still have a regular job,
Yeah.
but I'm retiring from the Guard.
It is what
from
it is.
military.
I didn't see you.
October.
No,
What you got in your office?
I was the environmental health and safety director.
Okay.
Started corporal.
Okay.
Okay, all right.
Thank
Yeah.
you.
You got a real job.
Yeah.
Are you gonna continue working?
We can,
Oh, yeah.
we can adjourn without,
Yeah, I'm not ready to-
I can just tell
Oh,
you.
you get a pretty good pension from the.
I will, and I'll.
Don't break
start
any
drawing
rules, it's
on it,
Friday
so.
at 4.
And so are you gonna?
So we're
gonna
adjourning the
invest it?
meeting at 3:40.
Probably.
Spend it?
Pay for all my animals,
There's
we
no
have
reporting
property out.
action on
There's
that.
seven. I have some animals.
Horses?
No, I have sheep and I have llamas.
Oh, okay. They're expensive. Feed and
The
stuff.
fencing, the hay,
Yeah.
all of that
How
kind
many
of
acres
stuff.
then?
I have 18 in pasture. Well, no, excuse me, I have about 13 in pasture, 5 in wood.
Cool.
Trees.
So